am fantastic. I hope you are ready for day 2 of the Paula J. Carter Center's Senior Summer School. Before we officially get started with day 2, I just want to briefly go back for the recap of yesterday. And as I was looking through your evaluations, and thank you, by the way, for completing the evaluations, because that gives the center input as far as developing our programs. And some of the things that, before I move on, I'm going to introduce and make sure our sites are all connected. I see that they are, but I'm going to start with Carruthersville. Good morning, Carruthersville.
Good morning.
All right, let's move up the virtual highway. Sykeston, good morning.
Good morning.
All right, impressive, enthusiastic folks. Let's move up to St. Louis. Good morning, St. Louis.
Good morning.
All right. Yesterday, some of the things that I noted in your evaluations as it related to Ms. Finley's presentation on the way you do the things you do, some of the things that I noted from the evaluations, I'm going to start with Carruthersville. And your names are not on here. It's just something that I saw a consistent pattern of. And one of the things that I noticed from the whole group, from everybody, it was the goal setting, which was what I noted on my notes as far as having the SMART goals, which are specific, measurable, action-oriented, realistic, and time-based. And some of the other things that I personally noted was the consequences are teachers, and they can be good teachers. And I never looked at it from that aspect, but I thought, well, that's different as far as it relates to a consequence. Look at it, you could turn it into a positive for you. You really can. And another thing that I captured from Ms. Finley's presentation, which the center tries to promote in all that we do as it relates to conveying physical health, psychological health, but another key component to good health is social interaction. And I thought that was fantastic for her to bring up that other key concept as it relates to healthy aging. Another, moving up the highway here, St. Louis, I looked through your comments, and one of the things that I noticed was very important that Ms. Finley said yesterday, that the environment does play an influence, it does have an influence on your habits, which that is also true. The one thing that I will add in here and end, as far as the Jeff City area, Missouri, one of the notes that I kind of zeroed in was how important it is to exercise as much as your health will allow. And also, one of the things this participant indicated, that you try to do it on a regular basis. And also another key thing too was try to eat healthy, breakfast, vegetables, and fruits. So I just wanted to share that with you, and each day I'll try to do a recap, and I will just pull evaluations from each site and just kind of go back, and we'll just go through daily from that aspect. Now, moving on to our presenter number 2, before I officially announce our presenter for today, who is a family, Lincoln University Cooperative Extension family member. It is always good to get speakers who are like Ms. Finley. We knew yesterday that she would be an excellent speaker because she has been a presenter for the center before, for 2 other, for our Lunch and Learn, even for MEMA. So we knew that. But also, the presenter today, I think, will be an awesome presenter too, because she can relate from a personal experience is what she will talk about today. And I think that's important, especially if someone encounters and experiences something, and they can if they're reputable, which she is, can kind of guide you into the right direction. So I'm going to go ahead and give you a little background information on our speaker for today. Ms. Patrice is the Regional Coordinator for the Lincoln University Cooperative Extension St. Louis Urban Impact Impact Center. Ms. Dollar received her Bachelor's of Science degree in Family and Consumer Sciences from Fort Valley State University in Fort Valley, Georgia. Ms. Dollar completed her Master's of Science degree in Family Resource Management from Iowa State University in Ames, Iowa, and a Certificate of Financial Planning from the College of Financial Planning in Denver, Colorado. Ms. Dollar began her extension career with the University of Missouri, Columbia as a regional specialist. She accepted a state specialist position at the University of Georgia in 2001. In June 2004, she became the regional coordinator for the Lincoln University Cooperative Extension's office in St. Louis. Please welcome Ms. Patrice Dollar. I'm turning it over to you.
Thank you.
You're welcome.
Okay. When I talked with well, good morning, everyone, first of all. When I talked with Miss Yvonne last week, she actually called and asked me, she said, Patrice, can you just talk about estate planning in terms of wills and transfer of property, and talk about, healthcare directory and guardianship? I said, sure, I can talk about that. I mean, it's something I've been talking about for a while, but also have been working with in terms of my own mother. So I said, I can do that. So I talked with Deborah Jenkins, and we kind of put together some resources that seniors can rely on. And so everybody should have a packet with them that has a few things with them. One, it should have grandmother's yellow pie plate, and I'll talk about that shortly. And then it should have a estate planning checklist. And that checklist is really good. It has 25 things on it that you can do to get your estate in order. And I'm going to add a few things to that list that I think will be helpful. And then the other thing, or the last thing I think you might have, is guardianship and conservatorship. Yeah, guardianship and conservatorship in Missouri. And so we'll talk about that. And then I believe that there is an evaluation there that you guys can also refer to. But I'm going to start first with the 25 things that get your estate in order, because that's kind of the gist of the presentation. Because when you think of estate planning, you think of how do I transfer my property once I'm gone? And most people think that a will is the only way to do it. It is certainly one of the ways to do it, but many people are concerned about the probate process, and it's not really as involved as we think. Probate is just a way of validating the will itself, but there are other ways that you can transfer property outside of a will, and that is something that's called a beneficiary deed, or it's called transfer upon death or payable upon death. And that basically says that I can things that are property you can transfer upon death, and that would be like a house or land that you own. If there are bonds that you own, any actual tangible property, you can transfer that upon death. That's called TOD. That's how it's referred to. POD is payable upon death. And again, that's done outside of a will. And so many people think that a will is the only way that I can transfer property, but you can use both the TOD and POD, which is transferable upon death is TOD, payable upon death is cash that's paid upon death. Okay. So those are three things in which, 3 ways in which to transfer property upon death. And then Ms. Yvonne also let me talk a little bit about the living will. I'm just going to go down the list that you guys have here. Many of them come right into play with the item that's just above it. Making a living will relates more to your health care, because you're making a living will saying that how I want my health to be cared for. Some people will call it a proxy, a medical proxy. Some people call it a healthcare proxy, but it's an instrument to use in which you basically say, this is the kind of health care I want. I don't want to be resuscitated. You can say that. I don't want any extraordinary measures taken to save my life. So I don't want to be kept alive on a respirator. So those are all the things you can put in your living will. It's just a directive in terms. It's also called a healthcare directory too. It's this page right here. I see you looking for. It's this one right here. It says 25 things right here. Okay, right here. And so those, it's basically you're specifying what medical procedures you do or do not want taken in terms of your own life. I would suggest that anybody that's making out a living will or a healthcare proxy or healthcare directory, talk with your doctor, because he knows the terminology in which should be used and specify what you want or do not want to be used in terms of maintaining your life. Because many people say, I don't ever want to be kept alive on a machine. Just my brain dead and I can't walk, I can't feed myself. So that's one way that you can express that, is using that living will or using a healthcare directory, medical proxy. It all refers basically the same thing as an instrument in which you communicate to your doctor and to your family what measures you do or do not want taken. The other item, and people don't think about this as much, is create a durable power of attorney. What if you become incapacitated? What happens? We have to think about it. What happens if you become incapacitated? Many people think that they make out a power of attorney, that is fine, and that will work. If it's not a durable power of attorney, it becomes ineffective when you become incapacitated. A durable power of attorney springs into action when you become incapacitated. So a durable power of attorney is still valid when you become incapacitated, but a power of attorney becomes null and void when you become incapacitated. So I want to make sure people understand the difference between the two types. The durable power of attorney is effective when you become incapacitated, when you're unable to make your own decisions. And so when we look at this information, there's more than one type of power of attorney. There's a personal and financial one, which deals with your financial affairs, paying your bills, taking care of your property, and then there's also one for health care, for making health care decisions. And I know that in my training, we were told that the two should not be the same person. You want to pick one person for financial affairs and one person for making healthcare decisions, just in case there's an issue of morality in there. But again, the dual power attorney is something that I think people need to consider in terms of if you become even incapacitated for a short period of time. Say that you were in a hospital and you just weren't able to take care of things for yourself, that dual power attorney springs into action for you. Okay. Create a letter of instruction. And most people think, well, I've completed the will. I know when my father passed, he said, well, I got everything in order. Don't worry about it. My nickname is Niecy. He said, don't worry about it, Niecy. I got everything in order. So when he passed away, and the attorney came to the house and had the will, and we all read the will, and I thought, well, wait a minute, there's some things in here that are not listed. Right. There were a lot of things that weren't listed. So again, you may think that a will takes care of everything, but this list gives you an idea that there's so many other things that you do need to take care of. And there's something called a letter of instruction that kind of directs the will and tells you what way or what things should be done and when they should be done, where they're even located. Because that's important too. Because many times we'll say, well, where's the title to the car or the title to the property? So that's what the letter instruction does. It lays out for you instructions that the survivor wants you to follow. If you wanted to, I remember when I was at the University of Georgia, a guy passed away suddenly, but they buried him in a UGA coffin. I said, where in the devil did they? Anyway, they found a coffin that inside had UGA emblem and everything on it. And I thought, he specified in a letter of instruction how he wanted to be buried. So if you want to be buried in your white dress, then you can put that in your letter of instruction. If you want to be buried in a red dress, you can put it in a letter of instruction. It's up to you. So that's what a letter of instruction does. But that's also where we talked about grandma's yellow pie plate. If there were things that, say for example, that are not hard property, like a house or a car or whatever, but say there was pieces of jewelry, or there were things like a yellow pie plate that somebody may have wanted and grandma wanted to pass it on to you, you can pass that on in a letter of instruction. They're just things, your personal belongings, furniture that you want to pass on to somebody else, that may be clothes or whatever, things that necessarily are not in a will. That's what the letter instruction does. Plus, the letter instruction can kind of direct the will in terms of maybe who needs to be present for the will reading. So the letter instruction is something that you certainly want to add, because it's things that you don't normally put in the will, but you can put in a letter of instruction. The other thing down there is calculate your net worth is included in here. And I can say this for example, if you are looking at what's my net worth, if you're making out your will, one of the most important things you want to know is, what am I including in this will? You know, so if you do a net worth, that means looking at your assets and your liabilities, saying this is what I'm worth, this is what I have to pass on to somebody else. So it's important to know that even before you do a will, so that you can pass that on. Establishing a trust. Now, I will say that many people think that a trust is outside the realm of what they need to do, but if you have young children or grandchildren you want to pass things on to, a trust can be used for doing just that. So let's just think about, a trust can be used for passing on things that are beneficiary for young children or for any member of the family. Some people set up educational trusts, and again, that's for passing on things that we want to make sure that they don't go through probate, but they're in a trust. And I noticed, and I looked at this information, and Deborah and I kind of pulled this together, I noticed that there's a typo here. That should be on that last line down, that should be life insurance. For example, you might need to set up a trust if you name minor children as your life insurance beneficiary, not your life insurance beneficiary. So I want to point that out to you and make that a correction. When in terms of setting up a trust can be done with insurance. It can be done with annuities. Any type of investments you have, you can put in that trust. Okay. Consider funeral pre-planning. I stress to individuals, always consider what benefits that you have that you may pass on to someone else. Anybody that's been in the military, for example, my father was in the military. He passed away. My mom is entitled to his benefits. Okay. There are other members or seniors who may be in your computer classes, as well as you, who may have been married to someone in the military. You're entitled to those benefits. And so again, how will that person know that if that's not communicated in some way? So again, we need to be able to communicate that in some way. And so important documents in terms of funeral arrangements, in terms of military benefits, those all need to be made available. Make arrangements for orderly transfer of business assets. If you have a business, I think that there's probably a different type of will you want to have written. If you have a business that you're transferring to, you certainly need to work with an attorney to set up a will for transferring your business. Some business can be transferred even through a trust, so that you can avoid the process of probate. But when you look at doing transferring business assets, those assets can be sticky because you've got family members, and then if you've got business partners that are outside the family is wondering where do they fit in with the business itself, and that business partner is also wondering where does he fit in with the family, because normally the business is passed on to the business partner, but the family has some rights in terms of ownership too. Let's talk about insurance planning. And I'm just following this sheet, and I know that there's some others that we probably need to go back to. But when you talk about insurance planning, buying insurance, insurance serves as an immediate source of cash. So whenever you look at having a funeral and you go to make the arrangements, the first thing you want to consider is, how am I going to pay for this? How am I going to pay for this? So usually there's a funeral director will talk to you about the insurance policies. But I would suggest that you do a little research yourself before you even talk to the director to find out what's available in the policy, because family members may not communicate one way or the other what's available. I know in my dad's case, he thought, like I said, he thought he had everything planned, but in reality, we had to do a lot of research to dig and find certain things. So the life insurance provides a source of cash that's exempted from federal and state income tax. That's real important because that's a source of cash that you're not having to pay taxes on, and you can use for your burial expenses, any of your last health care expense, because who knows in terms of when a person passes away, if there are any final expenses not covered by the health care policy. And then you can use those life insurance proceeds to help with those health care expenses. But it also may help with some day-to-day living expenses. If you need to tie it over into your benefits start, whether it's Social Security or other benefits that may start, those life insurance benefits can help you pay those monthly bills. If you got a mortgage that you're still paying, those are the kinds of things you're looking at the life insurance covering. Okay. Number 10 on this list is consider buying health care medical insurance. And I will say, when we talk about seniors, not many seniors have considered that you may need long-term care insurance. And long-term care insurance is something that is underrated because most people will need long-term care insurance in their lifetime because we're living longer. And when we live longer, we tend to need more additional help because our health may not always continue to be the same. I know ever since I was in grad school, my concern has always been my well-being. And so that's why I've always been concerned about my well-being, and my well-being in terms of being physically and mentally able to do the things that I like to do. And so, but as you get older, you realize there are less and less things you can do. And, when we think about it, some people living way into their 90s and into being 100 years of age. Al Roker, they show on the Today Show every week or so, somebody that's at least, 100 years of age. So you have to think about, am I going to have resources to continue to take care of me for that long period of time? You can spend a third of your lifetime into retirement, meaning I may have retired at 62 or 65, and I may live another 20 or 30 years. Well, I have enough resources to continue living, and so that's what long-term care insurance basically is looking at providing some additional resources. If you were to ever go into a facility and need assistance, long-term care will be there for you, or if you need to use long-term care and someone had to come into your home and take care of you. I think the average of someone going into a facility and staying in a facility is about 3 years, anywhere from 3 to 3.5 years in terms of actually living like in a nursing home. So you want your nursing home policy to be at least a minimum like 3 years in terms of providing health care. Okay. And then a couple other insurances mentioned here are major medical care insurance, which protect you against the rising cost of health care. And we all know, I don't know about anybody else, but I think health care has risen more in the past 5 years than than 20 years before, I put it that way. But again, so you want to look at making sure you have health care insurance. And probably, most seniors are on Medicare, but they may have some other supplemental insurance. You want to have that supplemental to help you with that. And then disability insurance provides you an income if you can no longer work. And so a lot of people don't realize that what happens if I have a disability. And, normally people will say, I'm not worried about a disability because I can just get Social Security if I'm disabled. And that may be true, but, Social Security does not provide a substantial amount of income in terms of being able to day-to-day living expenses. So I recommend that, if this disability insurance is available, you can buy it. But again, those disability insurance, long-term care insurance, those insurances cost more as you get older. They tend to cost you more each year. And I can remember when I was going through the studies for insurance licensing, that they actually said that you want to try and buy your insurance even before you're age 60. For sure, but if you could in age 40, and I thought, who in the world thinks buying long-term care insurance at age 40? But anyway, that's kind of the thinking in terms of pricing. You can buy at a much lower price price, a much cheaper price if you buy it in your 40s and your 50s. If you wait to get in your 60s, it's quite expensive. And once you get a certain age, they're not even interested in selling you insurance, not long-term care insurance. Because again, they said they know you'll need it fairly soon, so they're not willing to sell it to you because it's going to be on a losing end for them in terms of probability. Okay. Review your pension survivor benefits. And again, if there's military survival benefits or there's survival benefits with Medicare, you want to make sure you check into those and make those known to your family members. When you talk about setting up, when people have pension plans, you usually select from your pension plan how you want to be paid. If you want to be paid just you only, or if you want to be paid you plus a survival, which means whatever portion, you elect to get a smaller portion now, and a part of that can go to your survival after you pass. So you have that choice when you start your pension benefits. And that really doesn't change unless you get divorced or married, and then they give you a chance to change that. But once you set it up, it really doesn't change unless you have a what they call a life-changing event. Okay. Our IRAs and 401k retirement plans, again, those plans are plans that that you paid into. And most people will say, well, I've got a retirement plan with my job. I always say that there's like a three-legged stool. If you can imagine a three-legged stool, one leg is Social Security, one leg may be retirement from wherever job you work or pension, and that third leg is anything that you've saved in an IRA or a 401k, and that's the third leg of that stool. And that those investments or those benefits will be there to help you when you retire. Because again, think about retirement. I'm spending a third of my life in retirement, so I want to make sure I have income to be able to take care of my expenses. But in addition to taking care of my personal expenses, what if I want to travel and see my grandkids? Or, what if I want to go on a cruise with my friends? What if we want to go to Vegas for the weekend? We can do that. We just want to have, enjoy life. And so if you consider making a third-legged stool, then you've got a little bit of resources to draw upon. Okay. The other thing listed here on this page is organizing financial records. And so what I did is I did a little bit of research beyond what Deborah and I talked about, and I pulled a resource, and I'll try to make sure I get it to Deborah sometime today, but it's called Roadmap for Important Papers. And that's part of organizing your financial records. If you create financial records, and everybody has records, you just may not have them all together. But when I went online, I went to the University of Minnesota is a good website. That's where that yellow pie plate came from that you guys have. But this particular publication you don't have, it's called the Roadmap for Important Papers, and it's from the University of Minnesota. And I'll make sure, Deborah, that I send you at least a link on it. But I found it to be very thorough in terms of looking at what kinds of things I need to keep track of and need to pass on to my relatives. So when we talk about a list of accounts, list of account numbers and pertinent information about your investments and bank accounts and life insurance policy, this particular publication has, I did a check mark by everything that's down here. This publication has it all. But it has the account number, a place for putting account numbers, insurance policies, different types, a list of valuable documents. That would be, for example, military papers, birth records, marriage certificates, divorce decree, estate planning documents. So it's got all of that. And even though you think those records are not that important to somebody else, they are. Because if somebody's transacting business for you, and I've had to do that a lot with my mom, I've had to have her birth certificate, her marriage certificate I'm still trying to find. But I'm still trying to find which county it's in. But again, you talk about death certificate. I've had to get my grandparents' death certificate to be able to prove certain things with my mom. So you think that those records are not important, but they are very important, because whenever you're trying to claim property, they want to know, who are you? How are you related to this person? So I've had to use my birth certificate to show my relation to my parents. So again, those records are very important to keep in one place. And again, that publication helps you to say what they are and where they're located. A list of personal data, your social security number, your driver's license. You know, I can't, almost every week that I'm taking care of things for my mom, I need her social for everything. So again, and there are times when my father's deceased, my mom's still living, but I'm transaction business for her, but based on his benefits, so I also need his social. So again, you have to think about what other social security numbers are needed in terms of somebody transacting business for me. Make arrangements for access to a safe deposit box. And if you have a safe deposit box, some people will have safes at home, some people have safe deposit box at the bank. But how do your family members know that? That's why a document like this one from the University of Minnesota allows you to write down where everything is, so that you can pass that on to somebody else. And then I'll talk about where you need to keep that type of document once you get it complete. But again, you want to make sure that you record all that information. So security number, your driver's license number, if you've got a VA claim, which is Veteran Administration, a date of birth, your name and phone numbers of all your family members again, and then make arrangements for access to a safety deposit box. Where's that box being kept, and where's the key? Who has it? You know, again, usually it's one key you have, and then the bank has another key where you need to be able to get into the safety deposit box. Again, somebody needs to know where that key is. Otherwise, you've got an issue there, right? List loan payments. You know, if there are any credit cards or mortgage or consumer loans, auto or personal loans that need to be paid, again, they need to be also maintained in the same document I talk about with the roadmap for important payments, okay? Because those are all things that are issues when you have to deal with someone else's personal financial information. List your sources of income, your government benefits that are available to you in case you're incapacitated. Somebody needs to take care of you. They're going to need to know all that information. You think I can tell them that, but what if you can't talk? What if you can't communicate that information to them? Okay. A list of tax records. Now that was the one thing I did not find on this form, is a location of tax records, and that's important. But you can contact the IRS and get copies of those tax records. I want to say that. You can contact the IRS and do that. And there is a form, I cannot call the name of it right now, but I do have that information because my sister works for the IRS, and I said, okay, what form do I need to get past tax information for mom and dad? So, but again, you can contact the IRS and find that out fairly easy. Verify account ownership and beneficiary designations. Again, life insurance is one way too that you can pass on, let's say, cash or monetary benefits to, say, family members. You normally designate a beneficiary on that life insurance policy. A will can't change that. Whoever you put on that policy, that's who gets that policy. That's who benefits from that policy. Okay, so you need to know that a will can't change that. If you want to change who's on that policy, you need to go directly to your representative for that company and change it. And then I would also recommend that, and I'm sure they'll have you do a date to change for whoever you want to receive that policy. The same thing if you want to change whoever's going to receive your pension benefits, you need to change that with the pension company, and then you date the change whenever it's made. If you want to make any changes on your beneficiaries, okay? I'm going so fast that they're not going to stop me. List the organizations you have been a member of. Now, I didn't find this in that Minnesota publication either. There are organizations that pay benefits based upon death of a member. Again, I use my family, my experiences as an example, but when my father passed, he was a member of American Legion Hall. He'd been a member for years, I don't know, maybe 30, 40, I don't know how long, 30 years maybe. But when he passed, they actually got in touch with my family and said he was owed, my mom was owed a death benefit. And so they actually bought a check by the house for my mom, which we had no idea that there was a benefit that could be paid. So again, keeping a list of those organizations can help your family members in terms of determining, contacting those agencies, seeing if there are actually any benefits that are payable. So, personal planning, provide a trusted family member friend. We talked about where to keep those records. And one of the things I will say is once you make out an important record, documentation, make sure that you keep one at least for safekeeping in a safe somewhere, and maybe one that's in your home somewhere safe. Notify your family members or where it is, so somebody will know that you have this information. So make sure friends and family members are aware of the information, and an attorney as well. If you're working with an attorney, make sure you notify them of where the information is. Make sure they have easy access to the will and durable power attorney by making everybody know if you name an executor, make sure the executor know where the will is. Okay. You work with an attorney, usually there's a copy of the will kept with the attorney's office. But also notify someone else in your family where that will is and who the executor is going to be. If you keep a copy at your home, make sure you keep it in maybe in a fireproof safe or something so that it is protected. But make sure somebody knows how to get in that safe in case you do need it. Because if something happens and you've got the information there and nobody can get in the safe, who knows what the information is? It's not useful if it's not accessible. So, also, and for you pet owners, this is the last one. Now, I don't own a pet. I love dogs. Me and cats don't get along. But for you pet owners, if you've got a dog or a cat that you've grown accustomed to, make sure you keep their records as well. And I know people laugh about having pet insurance. You know, it's up to the owner. It's up to the owner is what I say. But provide the name of the vet, so the vet will have his records on that particular dog, cat, or whatever animal it is. And also that you communicate your wishes to that dog or pet as well. You know, you heard of people leaving fortunes to dogs, right? And you think these people are great. Okay, all right, now leave it alone. It's up to you in terms of how you want to relay that information, but make sure that it is available and that you communicate that information. Now, I want to talk about a couple other things that we have here that weren't part of that 25 things. Well, I talked about two, and that was the TOD and the TOD. But there is something else that's called the guardianship. And the guardianship and conservatorship in Missouri is the publication I'm on right now. Well, let's talk a little bit about a guardianship and conservatorship. In some states they are combined, in some states they are separate. In the state of Georgia, they are together, meaning that one person can do both. But what a guardianship is they act in the best interest of the individual. They call them a ward or that individual. You only want a guardianship or a conservatorship if you actually... Miss Purdy, can you close that door? Sorry, we had a disturbance. But if you, a guardianship and conservatorship really only comes into play when you cannot make decisions for yourself, or you're not physically able to take care of yourself or make decisions for yourself. So let's think about that first of all. It takes a judge's action. So you have to go to court. You petition the court for a guardianship and conservatorship. Our guardianship is basically for the individual, it's for the ward, to make sure that the person physically is taken care of, that they're fed and clothed and doctor's appointments and, you know, whatever their needs are, that's the physical care of that person. That's the guardianship. The conservatorship has to do with the financial part of the care of that person. So that would be their resources, that their bills are paid, that their property is taken care of. So that's the financial part of it, is the conservatorship. The physical part is the guardianship. And I said those, in some states they're separate, and in other states they may be combined. And how they work is you actually petition the court, and you go to court, and the judge will have to determine whether or not that individual is considered physically or mentally able to take care of themselves before declaring a guardianship or custodialship. And what happens with the guardianship is that you petition the court. Normally there's a fee that's set aside for that. An application is filled out, and you'll go to a hearing. That hearing is usually had with the judge, and it'll just be maybe there'll be the attorney for you, there'll be the attorney for the individual there, and there'll be the judge, and anyone else that you may ask to come in with you. And so you'll make the petition, and they may not make a ruling at that point in time unless it is an emergency guardianship, and I'll talk about that in just a moment. But so they'll have a hearing, and you'll petition. They usually give you like 30 or 60 days, sometimes 90 days out, depending upon the court, to come back before they actually make a ruling on that person's guardianship or conservatorship. In the meantime, they may ask that you have a doctor do an assessment of that individual's health to see in terms of they are mentally able to take care of themselves. I'm on the guardianship page. Okay, so they'll have the doctor do an assessment to determine whether or not that individual is able to take care of himself. That information it comes back into the court whenever you have the hearing with the judge, and the judge will take that information in consideration as to whether or not that person is able to take care of himself. Now, the doctors make the assessment, and that doctor's assessment goes a long ways. In some cases, they may use one doctor or two doctors in terms of making an assessment. And then you come back in the court, maybe after that first hearing, maybe 30 or 60 days out, and then the judge will make a ruling on whether or not that individual can actually be declared what they call incompetent, and then a guardianship and a custodian and a conservatorship is set for that individual. I will say, I'll say this much is whenever you do that, and I had to go through that process with my mother, and my brother and I did it together. And in the state of Georgia, it has to be two family members to do it. Now in Missouri, I didn't see in this information where they said two had to do it, but in the state of Georgia, two people had to go in and petition the court. And then we had we actually take her to the doctor. The caregivers took her to the doctor and had her assessed, and then that information was sent from the doctor's office over to the judge's office, and the judge made an assessment. With the guardianship, you have to each year do what I call an annual report. It's more like an annual review. There's two parts to the annual report, just like it was two parts to the conservatorship and guardianship. The guardianship, we have to answer questions about my mother's physical health, if there's been any change, if she's moved, if she still lives in the same location, we have to answer those questions. And then the financial part of it. And I had to submit all the financial records of where bills were paid for my mom each month in terms of her care, whether it was for buying food, for health care, for getting the grass cut, whatever. All of that has to be submitted to the judge on an annual basis. So you have to keep pretty good records, and thank God for computers, because I believe in paying bills online. So again, I can just go back online and pull out everything I paid, and that's why I try to do most things online. So I've already got a record of it. If you don't, you need to write a check, and on that check write what that item is for. The other thing that we had to do is we had to set up bond insurance. And that bond insurance bonded first year that if we were scouted with my mom's estate, then the insurance would pay for whatever was taken from the estate. So we had to buy bond insurance for that for the first 2 years with the guardianship and conservatorship. Okay. Let me see. The emergency guardianship was the one I was going to talk about. If you have to do an emergency guardianship, that's if the person is there's a substantial risk to the person. Say they're in their home and they don't have utilities, and you need to be able to pay their utility bill, or be able to make sure they're taken care of, or pay for their using their financial resources. An emergency guardianship can also be set up, and conservatorship can be set up. And in that case, the court appoints what they call an attorney ad litem. I think that's guardian ad litem is what they set up, and that's where there is an attorney for that particular person that you are getting a guardianship for, and they have to assess whether or not the person needs an emergency one. Just means you don't wait 60 or 90 days out. It's done right there. You set up an emergency hearing. They make a ruling in that hearing for that emergency guardianship. Okay, and then the permanent guardianship comes later on down the line, maybe in 69 days. But in the meantime, you've got temporary guardianship and conservatorship to be able to take care of that individual physically, and then also take care of all of their financial matters. So that's one is right away. The other one take you maybe about 60 to 90 days to set up. So, okay. I don't know, I was trying to see if there are any questions that, Deborah, I agreed.
Yes, ma'am. Let's start with our questions. Let's start with Carruthersville. Do you have any questions for Ms. Dollar? Carruthersville?
We don't have any questions right now.
Thank you, Carruthersville. Let's move up to Sidestep.
Hi, Patrice. This is Sykeston. This is Carolyn from Sykeston, and I have a question about, I guess, back in December, my mother got real sick, and she has a will, but it needed to be updated. So we went to the lawyer after she got out of the hospital and had it updated. Well, I wasn't aware of just how expensive a will could be. So my question for myself and the other ladies that are here, is there an organization or something that will help you at a lower cost to have a will set up? Or is there some type of way like that you can write a will and have it notarized or something and it hold up in court? I would like to know that for someone that can't afford to go to a lawyer and have a long will drawn out.
Okay, I've got a couple responses to that. One is that, can you hear me?
Yes, I can hear you.
Okay. One is that, first of all, people have been known to write wills on the back of paper towel or napkins. Let me say that.
Yes.
The other option is that there are wills that you can download online. That you can actually update a will using online. And then another option is there are office supply stores that have forms for writing wills. And an organization itself is the Bar Association can assist in terms of wills. If you're looking at using the Bar Association, I think they ask for a certain dollar amount. It's not very much in terms of making a donation to the Bar Association, but you can contact them. But, in terms of updating a will, I would say a will, if you wrote a will and say it's 20 years old, well, that needs to be updated. But in terms of keeping a will updated, if there have been any changes in terms of resources or property, you want to update the will. But if the will is, I would say you want to update a will every 3 to 5 years. Just as a recommendation. And if it's, if it's very costly going to an attorney, again, you've got some other resources that you can go to. You can use the Bar Association to contact them regarding wills. And there are attorneys that do not charge a whole lot to assist you with writing wills. Not everybody will charge you a couple $1,000 to write a will. I mean, you can go to attorneys. And the Bar Association may be where you can go and find out where you can find an attorney that'll help you in terms of writing a will, and it's not going to cost you that much money. And if you're updating one, certainly updating a will will be just taking the will that I currently have and making the changes that need to be made. So that should not be as costly as the initial will itself.
Right, it was happening.
Okay.
Okay, thank you very much.
Let's move up to Jeff City. Are there any questions here in Jefferson City for Ms. Dollar?
I wanted to ask her a question about the safe deposit box being closed when you pass. Now, my sons are on my safe deposit box. Would that make any difference where I'd have to go to probate before they can get into it?
To open the safety deposit box?
Yeah, it says in your statement where it's on death, it's closed until it's reopened for probate. Now, my son's names are on my safe deposit boxes.
Okay.
Would that make any difference, or do they have to wait till it go to probate?
You know, I'm gonna say he didn't have to wait, because if his name is on the safety deposit box, then he is part owner and already permission to go to that safety deposit box.
Just checking money, cause like when they said up here, I was like, uh-oh.
But if I were you, I would check with the bank now to make sure that if something happens, that he's able to access that safety deposit box. I know with my dad, we went to the safety deposit box and didn't have a problem with it.
Okay. Cause you said different states, so I didn't know whether, you know, Missouri.
Yeah, I know, that's why I said check with the bank and make sure, because it was a different state. And I've heard of cases where when a person dies and that there's a problem with getting into the safety deposit box, so I think that it's good that your son's name is on that safety deposit box. But I would check also with the bank to make sure that his name is on here if something happens to me, does he still have access to get into that safety deposit box? And I caution people when you put things only in your name, sometimes there's an issue with people being able to gain entry when it's just in your name. But you have to be careful when you title things in someone else's name, because you don't want to make a gift and you didn't mean to. Okay. All right.
Thank you.
We have another question for you, Ms. Dawn.
Just following up,
Okay.
just following up with her question, would it make a difference if the person, a member of your family, also had a key to the safety deposit box? Should you insist, when the name is added, on giving that person a key to the box? Would that make a difference?
Well, I was going to say, the name needs to be there, and if you have the key and something happens that they need to gain access, they should have access to your key as well. You can probably request a key, but they should have access to your key if something happens as well.
Thank you.
The bank only gives one key to the person
Right.
that owns the safe deposit box, and the bank has the other key. That's in my bank. I don't know what they do at other
Yeah.
banks.
Some
Well,
banks,
but again, first of all, you can't even get to that safe deposit box without the bank allowing you access to it. So if you put that person's name on it, they should have access to your key if you're putting their name on it.
All right. Back to you, St. Louis. We have another question?
Oh,
Well, I was just gonna make a comment. You were talking about conservatorship. And you were talking about in Georgia, how you have to have two people to apply for the conservatorship and guardianship over a person. And you said you weren't sure about Missouri. In Missouri, you just need one.
Okay.
I've actually done it,
That
so.
might be true in Missouri, but in Georgia, it had to be two family members, not just two people. It had to be two family members. And I was looking through the information for the state, and this may not give that detail, but most likely it's going to have to be a family member that makes that petition.
Right.
And not just anybody on the street that can make that petition. You've got to have some connection to that person.
Correct, but I was just, you just said you weren't sure. So I was just saying that here, you only have to have one person.
All
That
right,
is
we
a
have
family member.
one more comment or question from Jeff City.
I thank you very much for the wake-up call, because I had not taken care of any of this. So thank you very, very much.
Thank you.
Yeah.
All right,
We've got a question here in St. Louis.
Okay, when you appoint the executor, do you have to have that notarized?
Well, the executor is appointed in the will.
Like when you writing up your will or whatever, you have to have that notarized.
You know what, that is a question that I'm not sure about.
I was gonna just go write it and then say, put Sally on here, and then somebody said, well, I don't believe she wrote it, So it
Okay,
has to be
now wait a minute,
notarized.
now the will itself,
Not the will, I'm talking about when we was talking about.
yeah, but the will state who the executor is. The will states who the executor is of the estate.
Okay, well, the other thing we was talking about, the TDP and the PFO, when you know, if we just write somebody's name on there, would that have to be notarized? Because if somebody else in the family say she didn't say that, would that need to be notarized to prove that it was said?
It depends on which the will itself requires that you have an executor, and that does have to be validated. Okay, that has to be validated. The TOD and POD, they also have to be validated. They're not part of probate, but you do have to have those validated. There's a form actually that you complete, and it has to be notarized.
Okay.
Is there any more questions?
You got it.
We have another question from Sykeston.
It's not a question, I just want to say that on that safe deposit box, they don't give you but one key. So you have to let the one know that if you have another one on there with you, where that key is. Without that key, you cannot get in there. And they have to know where the key is, but they're not going to give but one key out. But that's safe deposit box.
I believe that was said in the question that you want, if you put the person's name on it, then you also need to let them know where the key is. If you have the key, then you need to let them know where the key is so that they got their name on it, they also have access to the key. What happened this time?
Thank you.
Oh, we still there yet? Okay. All right.
Do we have any more comments or questions for Ms. Dollar? This is Ms. Dollar. We have one more participant from Jeff City.
This is personal, so I may not be able to do it. It doesn't have anything to do with that grand information she's given us. So I'll hold off until we know that somebody doesn't have a question about her presentation.
All right.
Well, let me say this, I would suggest that if you have, I would suggest that if you're looking at doing any of this, I would at least talk with an attorney, even if you have to call the Bar Association, but do your research, go online in terms of looking at wills. And most people are afraid of doing wills because they think by doing a will, that means that I'm signing my death statement. But your wills basically are helping your family members because when you pass on, nobody, if you haven't stated or written somewhere what you want done, nobody else can say what you want done because everybody may say something different. So it's better if you put it in writing and you communicate. Some people have even put it on DVD. So people know that there's no question about it, this is what I want done. But if you don't do that, then you leave your family members in a state of disarray in terms of what you would like to have done if I want to sell this property or keep this property. So I'm saying from just a personal standpoint, give as many details as you possibly can. You can't give enough details in terms of telling what you want done or not done. Simply because nobody can read your mind. You're gone, and so nobody can determine what it is that you would have wanted done if you don't express it in some manner. So that's my comment. And I am not an attorney, but I have had some experience, and I also have studied the information in school in terms of estate planning. And so I will be the first one to say, do your research. Even before you go to an attorney, because they charge you by the hour. So you want to make sure that you figure out, I'm serious, you make sure what you want to ask that person about, even before you get there. You know, write out everything you need to have written out. If you have to get your daughter, your son, or grandchild to help you write, go ahead on and do that. But do your research and figure out what it is you want done before you get to an attorney, because he's sitting there on the clock. And so the longer you take, the more he makes. So that's the best thing I can say.
Did you have a question?
And this checklist is a very good checklist. And the only thing that I added was the TOD, which is transfer upon death, and the POD, which is payable upon death. So those are the two things that I added to this checklist. And in terms of guardianship and conservatorship, we talked about those, but again, you know, if you ever get to that point, you have to consider who would you want to take care of, you know. You say, well, one of my kids, they mean, maybe you don't want them to take care of you. They may not be the best one to take care of you. So let's find somebody that's kind-hearted, gonna be considerate, make sure you have what you need and what you want.
When they go to conservatorship, should that be notarized?
Oh, that you go to court. You go to court with that, so there's no doubt about that. Her question was on the guardianship and conservatorship, do you have to have that notarized? You go to court. So you don't have to worry about notarizing that, the judge take care of that.
This has been a very engaging class today. It really truly has. Oh my goodness. Miss Dawn, we have another person here has a question. She's a new person for the Paula J. Carter Center. Her name is Miss Andrea Kelly. Andrea?
I just wanted to know, who do you, like, when you give a, write out your will, who do you write your will to?
What do you mean, who do you write your will to?
Like, who do you have take care of? I mean, is it your choice on who you want to have take care of your will whenever you decide to write a will out?
It's not like you're writing a letter to somebody. When you make a will out, what you're basically doing is there's a form. You can find them even online or, like I said, in the office supply stores in terms of writing a will out. It's not written to anybody. It's written based upon my last will and testament is usually how they start out. And you'll say, this is what I want done, this is how I want it done. So you're not writing it to an individual, you're writing it basically about your own possessions. Will is transfer of property.
Okay.
Thank
Yes,
you.
we have one more question from here.
And we have another question here in St. Louis.
All right.
Can you speak on it? I was wondering if the guardianship could be reversed. Like if you want to have it reversed after you have had somebody over, then you decide that if something happened, that things change, that it can be reversed.
Okay, that's a very good question. Let me kind of sit back and take Guardianship, well, first of all, you know, in order to reverse it, you're gonna have to go to court. And there's certain things that you're gonna have to probably prove in terms of reversing guardianship and custodianship. I know before we set it up for my mom, we interviewed 2 attorneys. And we thought, because at the time my sister had power of attorney, and so we wanted to know that we just need to get power of attorney transferred to my brother and I. So we went to the attorney to talk about it. She said, you don't want to do power of attorney, you want to do guardianship and conservatorship because those are 2 that are difficult to reverse. Okay? Power of attorney can be overturned from one to the other. It's easier to overturn than a guardianship and conservatorship. Okay? All right.
Another thing about the
Miss Dollar,
comment.
go ahead, St. Louis.
Another thing, a comment just about you talking about the will, that if you don't have anything like a will, what you want, then I experienced it when my mother passed last year, before that. That she had written something down on a piece of paper, like you said. She had written something down on a piece of paper, but one time when they taken it to the attorney, he said that was no good.
Well,
then we did some of the things she said, like word of mouth, like I would tell you I want this, or I want that, and she would tell some of us I want that. But that's no good when it comes to, you know, the power of attorney. She had appointed my son, not my son, but my brother, a power of attorney over everything, you know. And but she didn't tell him exactly what she wanted, so we didn't know who she wanted to do a funeral, what she wanted to wear, either of those. So all of this came to be about, since it's 13 of us, that was a big confusion, you know. Somebody wanted this, somebody wanted that, somebody wanted to do something else. So what we had to do is decide on what was best for her, you know, what you think she likes, and go with that. Otherwise, you're going to have a big mess. That's when they come in on the two.
Remember I said there's never too many details.
Right.
So you try and communicate as many details as possible. But, you know, you were saying, the lawyer said that was no good. It depends on whether or not, if you've gone to court, a judge made a ruling whether that was no good, because it was signed and it meet all the requirements, because the judge really makes that determination rather than the attorney. If someone wanted to petition it, she said she wanted it done, you could have taken it to court and the judge made that determination. Now, because I've heard of people writing stuff on the back of, that's what she, you know, but my thing is write a will, write a formal will, and not just write things out on a piece of paper, because that could change from time to time, and even the date of it. You know, who said this was written a long time ago? It's not even valid right now. So again, you want to try and validate your will and not just write something on the back of a piece of paper. That's why we have this session today. So if people don't do that, is that you want to make sure you use the forms that are valid in terms of writing out a will. And I said you can go to office supply, you can go online and download them. These people all in our computer classes, you know, guys know how to go online and find that information. But again, you know, you can, as I said, contact the Bar Association, and you've got Google the Bar Association for Missouri, and the information will come right up for you in terms of being able to find an attorney, or even contact the Bar Association. So, there you go. Thank you.
Ms. Dollar, obviously we need to have a part 2 of your presentation.
Let me say that I enjoyed doing this morning, but we are in the midst of summer school.
Yes,
and so we're
going to wrap it up for you. All right.
So when people come to the door, we got about 60 to 65 kids here, so yeah.
Right. The St. Louis office has a youth program going on as we speak, and so we're really going to have to wrap this up, but it is obvious we will have to have her back again. So please join me for a round of applause again. Thank you very much. Let's say goodbye to each side, starting with Caruthersville. And we'll hope to see you tomorrow for the continuation of our summer school. It'll be Just My Imagination. Caruthersville, we're going to depart. We look forward to seeing you all tomorrow. Dr. Mabel Grimes will be talking about Just My Imagination. And basically she'll be talking about what's on your bucket list. It's going to be interesting. Bye, Caruthersville. Thank you. Sykeston. Bye-bye, Sykeston. St. Louis.
Bye-bye.
Bye. Thank you. And thank you all for attending, and I hope to see you all again tomorrow. This was very good.
It was.
It really was.
Can I say,
Yes, ma'am, you may.
She said it was private.
It was private.
Oh, okay.
Yeah.
One of the little things she brought out was, when we got our will, we should have now, after I hear her, how much do you charge an hour? Because we sat there, you know, thinking, ask all the questions you want and take all the time you need, but before you go in there, how much do you charge an hour? And I think she said to get some things written down that you want, prepare a little bit before you go.
Yeah.
You did nothing about that. And then the second little thing is Central Bank, we have 3 keys, counting their key. They gave us 2 keys, this is way back when, so maybe it's changed.
And I think the lady back in the back said you have 2 keys.
We had 2 credits.
And I wonder why all these lists in a paper for unclaimed property, that, wonder what happens because of that. They've had 2 pages on 2 different occasions.
Yeah, that's it.
Unclaimed, and nobody comes forward.